Welcome to Medically Speaking. Our guests today are Dr. Abeer Eddib and Tammy Hibbert from Millard Fillmore Suburban Hospital, Robotic Surgery Center of Excellence. Guys, thanks for joining me today.
Thank you for having us, Mike.
Dr. Eddib, let's start with you. Let's talk about robotic surgery. If you can, for the viewers out there, explain what that is, maybe some of the advances that we've seen, especially when it comes to surgical recovery.
Well, robotic surgery is a type of minimally invasive surgery where we use very small incisions to approach the patient's surgical site. So instead of making large incisions like traditionally, where people used to have, multiple long incisions across the abdomen, we go through small little, 8 millimeter incisions and perform the surgery that way. The surgeon at all times is in control of the procedure. The robot is just an assisting device to help us accomplish that surgery. Robotics has come a long way in the past decade, where now we're able to do more and more procedures with it, and it offers patients smaller incisions, more precision, more control, which leads to a quicker recovery, less complications, and better overall surgical outcomes. So robotics is here to stay, and it has completely revolutionized the way we do the traditional surgery.
That's great. And so, Tammy, not just the patient care aspect, there's an awful lot of work that has to be done from the administration side. When you talk about becoming a center of excellence, what does that include when it comes to keeping patients safe and elevating levels of care?
Sure. So with any accreditation, you have to do a lot of work prior to making sure that you have policy and procedures in place to make sure that our patients are safe, and education for not only our staff, but our surgeons as well, who are performing these surgeries. And just making sure that they know how to use the equipment, that they know what outcomes they're looking for, and if any complications come up, how we address those. It elevates our center here by just making us more known to the public, that even though we're a small community hospital, we still offer this amazing robotic program that just makes them get back to their lives quicker and easier, less pain. And that's our ultimate goal and commitment to our patients.
So Dr. Eddib, let's turn to you. You've been a surgeon for a long time in Millard Suburban, but you serve now as the program director for that Center of Excellence. Can you share what that means in terms of the work that you and some of the other surgeons have had to do, the things you've had to demonstrate to make sure that you maintain that accreditation?
We've been doing, like you said, robotic surgery for a long time at Millard Fillmore Suburban. But I think what the accreditation does, it really just kind of aligns all our efforts and holds us accountable with outcomes. And I think it just validates externally what we've already been doing internally. There's a huge focus and a commitment from administration and from the whole health system into providing patient safety, high quality care. And I think this just goes to reaffirm that commitment by the hospital. And this accreditation is unique in that it starts from the preoperative care. Before the patient even gets the surgery, they make sure we have systems in place and guidelines, which we do, but it just kind of, like I said, validates that. And then it goes through the surgical procedure, making sure, the doctors are certified and the procedures are done safely and the equipment they need is available. It goes through the postoperative care, where they make sure that we have pathways in place to take care of the patients should anything come up, that we have appropriate consultative services, and that we have appropriate postoperative guidelines to make sure we are safe. And then it adds an outcome measure where it holds us accountable. It monitors our outcomes and reaccredits us every time by looking at those outcomes and making sure that we meet certain standards compared to the national benchmark. So I think it's a robust service program that goes through all those steps that makes sure our mission is to keep the patient safe, and that mission is aligned with the whole hospital, from ancillary staff to surgeons to nurses to the floors to everything.
I want to ask you a little bit about the differentiators. What does Suburban offer when it comes to robotic surgery from a programmatic standpoint? The specialties, things like that.
Sure. So we have a number of specialties, including general surgeries like hernia repairs, gynecology, oncology, urology, robotic Mako knee replacements, and joint replacements. We also have 5 robotic systems here at Suburban Hospital, which is a third of our operating rooms. And we do operate 6 days a week with scheduled robotic surgeries and then do them as needed if there's emergent or urgent cases.
So Tammy, you mentioned there are 5 robots at Suburban, and that obviously, provides an awful lot of volume for the hospital, probably which lines up with some of the large medical centers across the country. How does that elevate your team? What does it do for the docs and nurses there at Suburban when it comes to elevating care?
Well, we perform over 2,000 robotic surgeries a year here, which lines us up with larger university hospitals. We're at about the 17,000 surgery mark as well, since we started here in 2010. And one of the things that the surveyor said that stuck with me is that when she got here, she thought we were a small community hospital and didn't realize how big of a program that we had. So that just lines us up with larger university hospitals and letting our community know that we're committed to them and that we can offer this to them so they can get back on their feet quicker. And that our surgeons and the hospital system and nursing staff are really committed and dedicated to this program.
Doc, let me ask you the same question. This has been now almost 15 years of robotic surgery. You said it earlier, it's here to stay. From the physician perspective, what does that mean to you, and what does that mean for your patients?
Well, to me, I love the fact that we have so many operating robotic systems in the hospital, which not only allows us to offer more to our patients in the community, but also the number of surgeons that are accredited and trained to do robotic surgery. We have more than we've ever had, but also the collaboration among the different surgeons. Now, when it initially started out, it was one specialty. Urology was the highest user of the system. Now all specialties from general surgery to colorectal surgery to oncology to gynecology and the indications increase and expand with the advancement of the technology. So with the hospital's investment in the program and offering so many systems, allowing more surgeons, attracting more talent to be able to provide the best care for our community is a huge benefit that I think Millard Fillmore Suburban has.
I'll ask you both this question as well. Suburban is now, this year will celebrate its 50th anniversary of serving the North Towns. The surveyor said it to you, Tammy, in terms of they thought it was a small community hospital. That's not the case anymore, obviously. What are you most proud about? And what do you tell your patients when they're going through this process of maybe they come to Suburban for surgery, in particular robotic surgery?
I think what I'm most proud of is the fact that Kaleida Health and Suburban Hospital really embraced this technology, and they have helped us grow this program along with our nursing staff and our surgeon partners, that we wanted to bring something to our community that would help them and not the traditional surgeries and spending 7 nights in the hospital with the longer recovery. I think that the dedication and the commitment that everybody here has is just what makes me most proud to be a part of this team, and really just elevates this team, and this center of excellence will really elevate our program.
I'm really proud of the culture of collaboration among the multiple specialties. So this program has allowed the different specialties to really be able to collaborate more, whether, a general surgeon coming in to help a gynecologist or a urologist coming to help a colorectal surgeon. So the fact that we have so many specialties working at the same time, so many very talented, skilled surgeons on multiple robotic systems allows for tremendous opportunities for collaboration and multidisciplinary approach to really ultimately provide the best care for that patient at that time.
Indeed, that's what it's all about, the best care for the patient. I think the community knows now Millard Suburban is not that small community hospital anymore, really has become that center of excellence for robotics. Thanks for joining me.
Thank you, Mike.
Thank you.